Locals Only Newstalk 1520 KVTA with another great seminar, another free great seminar coming to the Community Memorial Health System. This time it's about age-related macular degeneration. And to tell us what that's all about is Dr. JillAnne McCarty from Community Memorial Health System. How are you?
Hi, Kelly. Doing just fine, thank you.
Well, good. Now, first of all, what's macular degeneration?
Well, you can think of macular degeneration as an aging change that affects the very middle of the retina. If you think about your eye like a camera where there's a lens in the front, which we have right behind our iris, and film in the back, which is what the retina is, macular degeneration is an age change in the very middle of the film of the camera. You know how we get age spots on our skin? Well, the pigment layer under the retina can deteriorate in the same way. And the vision sometimes doesn't change very much at all, but sometimes we see little areas of distortion when macular degeneration is getting started. In advanced disease, since just the middle of the retina is affected, it can affect your lifestyle for things like driving or reading or even recognizing people, but it never causes total blindness. The peripheral vision remains.
So how would you know that you're starting to have that? If I started having problems with my eyesight, the first thing I would do is, hit the 99-cent store for a pair of cheaters,
Well, it's often blurry vision. Many times, though, it's more distorted vision or diminished contrast. People feel like in dim light their vision isn't quite what it used to be. So the very first step in diagnosing macular degeneration is to come in for an eye exam. And the standard of care nowadays is for everybody over age 40 to have a baseline dilated eye exam with an ophthalmologist. And the dilated pupil allows the physician to actually have a very good enlarged stereo view of the macular detail. We can look right through the pupil and see the retina and see the macula. And then other things that we do, patients with macular degeneration have a little checkerboard that they can check at home to make sure things aren't changing. When people are diagnosed with macular degeneration, we do special studies. One is a fluorescein angiogram, where a little vegetable dye is injected and the blood vessels of the retina light up, and we can use that for definitive diagnosis. We can see where the problem is and also characterize the problem to help us in planning the treatment. And there's a newer technology called OCT, which is like having your picture taken, but it actually can show us down to almost the cell layer, the anatomy of the macula, and we can see those age spots, we can see swelling in the retina, and we can use that to track the treatment benefit.
Now, what is something that causes this? Is it just from getting old, or is it something that's...
Well, it is. Time marching on is probably the biggest risk factor because it is a degeneration or a deterioration in this tissue. But there's a wide range of patients that have it and don't have it. So the biggest risk factor is, besides age, is being Caucasian. We found that African Americans have a very low risk for macular degeneration. It turns out that Asians who have adopted a Western diet are also at higher risk, and Latinos have been studied and are equally at risk as Caucasians. There is a genetic factor. We think as many as 20 to 50% of macular degeneration involves people with a family history or having a genetic predisposition. Smoking is the biggest lifestyle risk factor. So folks that smoke have a much higher risk for macular degeneration. And the good news with that is if you quit smoking, after 20 years, your risk goes back to baseline, the same as a non-smoker.
Oh, really?
And the other newer data is now showing that risk factors, the same as heart disease, can also cause macular degeneration. So controlling high blood pressure, controlling your cholesterol and lipid, exercising so that obesity is controlled. People with a higher body mass index were at higher risk for developing macular degeneration. And then just most recently, diet, and that's something that's really been being continued to be studied because it has to be studied for many years to get proof. But omega-3 fatty acids that are present in fish, in wild-caught fish, and green leafy vegetables, flaxseed, those types of things, and keeping your vitamin D level normal have all been shown to be protective.
Oh, that's good to know.
Yep.
So there are things we can do to either prevent it or keep it from happening sooner rather than
Right,
later.
minimizing our risk. Folks with a family history of the disease might want to pay a lot more attention to lifestyle things that they can do to minimize their risk.
So, Dr. McCarty, what are some of the treatments for AMD?
Well, actually, there have been a phenomenal number of new developments in terms of treating both wet and dry macular degeneration. When we think about wet macular degeneration, that's the rapidly changing loss of central vision. And just in the last few years, injections that slow down blood vessels that leak and grow abnormally have been found to improve people's vision as many as 3 lines at the end of a year rather than losing vision.
Wow.
And 90% or 95% of people with this type of medicine had no loss of vision at the end of a year. And just most recently, a newer medicine called Eylea has been approved by the FDA, and that's a similar kind of medicine, but it lasts longer. Some of the injections need to be done as often as every month with Lucentis and Avastin, the anti-blood vessel growth medicines, and this newer medicine may cut the need for treatment in half, which would be phenomenal. And then in terms of treating advanced dry macular degeneration, some studies are now being done using stem cells where the nutrient layer for the retina is actually grown from stem cells and then can be injected under the retina to rescue photoreceptors and help maintain vision.
Wow.
And just finally, just in the last 3 months, the FDA has approved an intraocular telescope for folks with advanced macular degeneration, and that's just surgery like a cataract, but the implant lens uses an array of mirrors that can enlarge the central vision and allow people to use the peripheral healthy retina to look right at something, and then yet the peripheral vision stays normal. So that may allow people to make the most of their remaining vision.
Absolutely. Wow, that's a lot of treatments.
Yeah, so we're really trying to attack this disease from every angle.
And it's nice to know that if you do develop it, then there's hope.
That's right. Most people, if they get eye exams regularly and can get in and have an ophthalmologist see their eyes before the disease gets too far progressed, can enjoy good vision for their entire lives and have a good active lifestyle.
So the seminar is coming up when?
Our seminar is going to be Tuesday night, February the 28th at 6 o'clock in the evening at the Community Memorial Hospital. The phone number, if you would like to make a reservation, is 805-652-5436.
And, of course, you can also register online at cmhshealth.org/RSVP. And it's always free, but they need to know how many seats to set up. So thank you so much, Dr.
You're
McCarty.
Very welcome.
It's going to be a good talk.
I'm looking forward to it.
Awesome. Thank you so much for joining us on Locals Only.
Thank you, Kelly. My pleasure.
Have a great weekend.
Okay.
Bye-bye.
Bye-bye.